All this is Dr. Mobeen Sayed from drbeen.com. Welcome to one more show. So, how is everyone? What are what are the things that are happening? So, Michelle starts us. Dr. Bean, I PM on Facebook. If you get a chance to respond, please. Uh, I have been so much away from Facebook for so long. It is not even funny. So, I will respond. Um, Gold Country, how are you doing? Michelle, Alquin, Roy, Texas, Denise, James Crooks, Margaret, T. Hunter, D. Diaz, Algebra Bean. How is everyone? Skyfrog. What's Facebook exactly? So I have been really absent since we've been doing these talks, and my normal, regular routine things are not really in play. Gift 24/7. Gift 24 GT says my popcorn isn't done popping. Robin says, do you know anything about which hemorrhagic fever it is that has broken out in she's during this long lockdown for COVID? They're having, I do not know. Let's see. So if I go to, let's see, I'm gonna, couple of things. Uh, let's see. I'll do DuckDuckGo. So here we have DuckDuckGo and then hemorrhagic fever. China. And I will share my screen so we can all see this together. Ebola-like hemorrhagic fever virus now spreading in China. So, is there a are the quarantine camps in China for a hemorrhagic fever? I want to see this. So here, this is a PubMed. This is August 7. An emerging hemorrhagic fever in China caused by a novel Bunya virus. Okay, so there is severe fever with thrombocytopenia syndrome is an emerging hemorrhagic fever in rural areas of China and is caused by new Bunya virus. Bunya virus is a type of a virus as well, named after the disease. The transmission vectors and animal hosts of SFTSV are unclear. Ticks are the most likely transmission vectors, and domestic animals, including goats, dogs, and cattle, are potential amplifying hosts. Now, what I do not know is this is August. Let's see the August 7th. Oh, I think 2013. So that's totally different thing. The latest news that I'm seeing, these are not even, I'm not too fond of these. So I'll see if there is any more mainstream. So this is Patriots at Social. So I'll do some more study. It does not look to me as something more news. Ebola like hemorrhagic fever, perfect storm, WHO selected case sunset, multiple unclear transmission. So I don't see a Medscape genetic. All right, so I'll have to do more research. I don't much trust the ones that I'm reading. So John Doe says, have you looked over the Brazil study for lufimectin? FLCCC is very excited about it. Looks like a slam dunk in favor of ivermectin prophylaxis, at least with Delta. That's very interesting. I haven't looked into it because Omicron started and we just kept going with that. I would do it. This is a good question, Drew. I do not know if there are stats for that yet. So stats for rising complications of surgeries and appointments being cancelled. So how about we do this? Um, let's do a tinier chat today. I am looking to go to sleep a little early today, if that is okay. Um, Amy says, Dr. Bean, I found an amazing MCAS immuno because of you. Thank you. He's taking great care of me, waiting on D dimers and CRP labs, and I was shedding clots with Delta, tried to control MCAS. Very good. Very good. I hope that you recover fully and there is no issue. Praying for you and happy for you. So, a few of us interested in Corey's theory on ACQ working better than Luffy mechanism, actually, that is possible. And here is the possibility. This is a possible mechanism. And actually, Alive in Heels had kind of said it yesterday as well. She said one word, I believe, pH. So, the both of these words I cannot say here because of the repercussions. So let's say here is a cell. This is a nice little cell, kind of happy cell. It is, it can become sad if it is infected. So let's say there are two drugs, and here is the Omicron. And Omicron is now standing nearby, kind of mischievous, thinks that I'm going to hurt this cell. So the one connection is ACE2, correct? And so we know that HCQ, H, let's just call it H for our discussion. We know that H has an effect over here that it reduces the last amino acids um, modification, phosphorylation. So that causes the ACE2 receptor to be slightly different structurally. That reduces its binding affinity. So that is one. Second is when this thing is inside the Omicron, then, and this would be for many of the pathogens, and that is that when phagosome occurs or are formed, and okay, let me back up for a second. This is actually a very important theory, and it may be interesting to share it with others too. Omicron, from a study we are seeing, has a greater propensity to enter the cell through endosome as well, correct? That means Omicron will give rise to more phagocytes or more vacuoles in which it is trapped, in which it is present. Of course, it has a way to get out of it, but as soon as a phagosome or endosome is formed, our body also has a mechanism to try to destroy whatever is in the endosome. If the cell has endocytosed something, our body is going to try to make sure that it tries to destroy it. So the body is going to attach these little stomachs to it and try to destroy this. At the same time, this endosome will then, if it liberates the pathogen, then the pathogen would go into the endoplasmic reticulum, rough endoplasmic reticulum. There'll be ribosomes attached to the endoplasmic reticulum, and this is why this is called rough endoplasmic reticulum. And it's going to start using it, and then Golgi apparatus is here. So the our cells machinery will be used. Now, when that is being used, the H causes change in pH, right? So it makes it less acidic. So that means pH increases. When the pH increases, this is just as if our stomach's acids are not correctly released. So we won't be able to digest our food correctly. Similarly, when the acidity is not correct, then our vesicles, they do not operate correctly, and that hinders the virus or any other thing that is working in that environment. This will mean H will cause this regardless of what the virus's variant is. On the other hand, I needs a better connection here to interrupt. That is one. The second part is the disruption of the RDRP, which is going to be the same. So, in my opinion, they both will be effective. It is possible that I would have lost some efficacy because of the eye's connectivity with the ACE2 and mutation of the um, protein, spike protein. So that may have reduced the efficacy. But inside the cell, everything is going to work the same. So, very interesting question. So, I would actually think that H would have become even better. Texas, what is going on? Paul Borg, more opportunities or potty humor? Okay, so Kevin D. Morrow says, since Omicron evades neutralizing antibodies, does getting Omicron as a breakthrough case cause the body to develop new antibodies? Yes. If yes, how does the naturally immunity compare to those unvaccinated? Compared to those, how does the naturally acquired immunity from Omicron compare to those unvaccinated? So if somebody gets Omicron, and let's say they were, let's look at various scenarios, and I probably need a little clarification from your question, but let's say this is Omicron and it has arrived in a person who is who is whose immune system is naive to this virus. If that is the case, they will make new antibodies, no issues. That is the normal process. And again, it is possible that some people will fall ill and too ill and may even die, but this is the normal immune behavior. So that's one possibility. The other possibility is that somebody has the antibodies either because of the previous infection with Delta or by the vaccines. And that is where it is possible that Omicron evades them. And if it evades them, that doesn't mean that the immune system, contrary to many folks who have been kind of projecting this or saying this incorrect mechanism, that now the immune system would just be disabled. Immune system will not be disabled. What would happen is the immune system is going to attack this virus now as if it is new, as you're saying, Kevin. And so the problem is that as the immune system is going to attack it as if it is a new virus, immune system is going to take time. So it's going to take 5 days, 7 days, 20 days. Everybody's immune system is different. Some people will not be able to mount a good response. So this is where the risk is, that this virus could even kill someone. But immune system will create a response and new antibodies will be formed. Now, let's say, so scenario one, naive, scenario two, antibodies. Now you are saying unvaccinated. So this is unvaccinated, correct? Or previously infected, non-infected. This is vaccinated or previously infected. In either way, they both will develop similar antibodies. I mean, considering that there are risks and that all can happen, but they both will develop antibodies. Those antibodies are in both naturally acquired antibodies and they will work similarly. Now, this is true that everybody's immune system is different. And so some people's immune system is reacting too much and causing too much damage, some is less, some are able to mount the response, some are not able to mount the response. So considering that all that is possible, this is the general mechanism. So there will be no issues either way. So this is a good question, and I think I need to talk about it. The CBD actually keeps the spike proteins from attaching, so that may be an interruption as well. So I have to actually study or present that study. Maybe we do that tomorrow. So let me write it down. CBD and Omicron. So raised on rock 90 says, my husband and I tested positive on Tuesday. I'm 27 weeks pregnant and vaccinated. Only had a low grade fever yesterday, but got it down with Tylenol. Congestion, fatigue, cough are our symptoms. Thank you for sharing and praying that you become fully and completely recovered fast. And may you be safe, and your child be safe, and your family be safe. Ebony, this is a very old question in Dr. Bean's circles, that has the blood type any effect on Omicron? Same effect as with the other variants as well, that O type has a little more tendency because it has variation of the, possibly in some people of that type. There is a variation of factor 8, blood factor 8, which may create slight tendency to bleeding. In some people it is more, but majority it is really mild or not even of any interest. But because of that, their blood has a tendency to stay thin. So it is thought, there was a study from China that said that it seems that severity does not go as much, does not occur as much in this blood group. But that is really, the difference was not too much. So Kevin says, I meant, how does naturally acquired immunity after an Omicron breakthrough infection compare to naturally acquired immunity through unvaccinated? They are the same. So in the case of breakthrough infection, there are previous antibodies present and then there are new formed. Those new are formed in the same way as for a immune naive or unvaccinated. So they're the same. Very good question. So, Ebony, we talked about this question a bunch of times, so no worries. So, Trevor says, are you still optimistic about the pandemic's future? I am optimistic that it is going to end soon. My worry is it's the peak and the hospitalizations and the impact of that. We just have to make sure that we are safe during this time. We have to do, you are seeing that people with all of their care are getting the virus. So we just have to do more, whatever we can. And so, yeah. Robin says, is H better? So, Robin, from a mechanisms point of view, I would not think that H is just generally better than I. It seems like I would have lost some efficacy and H would have been similar as before. So, but yes, black seed oil is generally good as well. Ebony says, hello, I'm new to your channel. Welcome, Ebony. So Ali G says, when should a cancer patient should receive a fourth vaccine booster, and should he stop chemo before receiving the booster? So this is a question for the doctor. If the chemo is of the type where they are unable to produce antibodies or have a good immune response, then of course they'll have to figure out something. In my opinion, this is my opinion, not an advice. Considering the vaccines are probably not working as effectively, the monoclonal antibodies like AstraZeneca's long lasting monoclonal antibodies that can go on for 6 to 8 months, they may be also important in addition to any need for the vaccine. If they cannot take the vaccine because they are on chemo or they are on immunosuppression, then passive immunization is very important. AstraZeneca has a long-term passive immunization, which is excellent. I love it. But if their immune system is not that suppressed, then yes, they would not respond anyways because of the chemo and all that to a higher degree. But yes, whatever they can. So Nipa says black seed oil or black seeds are good enough. So I take black seed oil. Um, some folks say that the black seeds themselves have the coat also has molecules in them that are useful. So maybe some oil plus some of the black seed, but usually that coat is said to be not digestible. So oil is the one that people usually use. So Hingle McCringle Berry says, does Omicron infect the double vaccinated at a higher rate than unvaccinated? Not really. We did the California study, and the California study document is available everywhere. We can actually look at it right now. Let me see if I can actually open it. So this is the Southern California study. Give me 1 second. Whenever Adobe opens up a PDF, it has to scan the document and it takes time. Okay, so let me bring it here. So if I go there, there is an interesting table which shows this kind of the question, Hingle, it shows something in that direction. So let's see. Here, this is the table S3, predictors of symptomatic hospital admission with Omicron versus Delta. But let's look at the vaccines chart here. So I hope, so here, look at this. Unvaccinated are taken as a reference. That means whatever are the number of infections in unvaccinated, imagine that is one. So if there are 10 infections, consider them to be this one standard or reference. Now look at the infections in one dose, two dose, three dose. So if you see down here, adenovirus, one dose, compared to unvaccinated, the risk is, I believe this is risk table, right? Cases tested. So this is cases tested. So 0.24 compared to if taking the unvaccinated as one. So that means if it is unvaccinated had 10 cases for hospital, then vaccinated with one dose will have 2.4. If unvaccinated had 100 cases for hospital, then one dose will have 24. So number one, there is a difference. However, the interesting thing is as the doses would increase, you would see that that difference changes. For example, with two dose adenovirus, the difference is 0.37. So instead of reducing further from 0.24 to let's say 0.12, it actually increases. Similarly, if you see here, Moderna or Pfizer, one dose 0.22. Again, if I put it in, the reference is one. So we can say that if 100 unvaccinated folks are hospitalized, then 22, one dose will be hospitalized. That is their reference to each other. But if you look at two doses, then 19 in this case, but over here you can see the numbers are different. Anyways, 19. And then three doses is 15. There are some tables where you would see that for cases, as the number of doses are increasing, the number of cases are increasing as well. And so people say that, hey, it looks like unvaccinated are getting more sick. The more there are the doses, the more sick they are. So first, clarity that in this case, the unvaccinated are taken as the reference. So these are ratios of them, number one. Number two, Someone who just got the first vaccine dose, think about it. They, 2 years after the pandemic, they're getting their first vaccine dose. Many of them are youngsters, many of them are hopeful that, uh, confident that their body can take care of it, or they have supplements. So there are many reasons. Or there are folks who actually don't can't have it for religious reasons, or there are people who have previous allergies or other experiences in the past that have made them scared of it. The end result is there are a group of people who are getting the vaccination now. I would suspect that many of them are youngsters, and their catching the infection for them is generally a less severe outcome. Those who have two vaccines, like I do, they are usually in that range where they were more concerned that, hey, we need to become protected, and they went and got two vaccines. And now the two vaccines effect is waning, and so they would have infection as well, like I have. Three vaccine doses are those who are more exposed, for example, healthcare workers, and their exposure is more, and you're seeing that Omicron does not leave anyone. My friend who is a doctor, works in ICU, beautiful, excellent doctor, and said, had both the doses, and young. He's not my age. He is in 30s. In September, he got his booster. As soon as the booster was asked, as soon as the booster came out, he got the booster. However, now, last week or so, the whole family got the Omicron. He said that for him it was just upper respiratory tract and nothing else. No fever, no muscle aches, nothing, just like mine. So I was bragging to him that I only had two and he had three. And anyways, so those who are three doses, they have one, a requirement because they are more exposed, or they may have, just like you saw a question for chemo, they may be at risk individuals who need to have the third dose, and then those who may even not be at risk but are want to make sure that they are comfortable because their age or any other factors. So because of this, that increased number of doses with increased number of cases is seen, although this data does not show it because this is hospitalizations. uh, if you look at Omicron, so this side with 0.24, 0.3, this was Delta. Now if you look at Omicron, you would see that Omicron's ratio is actually more, and that is because the efficacy of vaccines is less for Omicron in general. So if you see here once again, the top, this is the third column now, this column, this one, the top is taken as the reference. That is the unvaccinated people. So once again, whatever is the number of them exposed for hospitalization, take that as one. And then one dose with adenovirus is compared to them 0.34. So that means if there are 100 unvaccinated individuals who end up in hospital, compared to them, if somebody had one dose of adenovirus, then 34 of them will end up in a hospital. If they had two adenovirus doses, then 58 of them. So this is the interesting thing, that as the doses are two, there are more people. And the reasons, as I mentioned before, there are actually, it's not, some folks are saying that this is because the more vaccine somebody has, the more issues with their efficacy is. I don't think it is that. And by saying I think, I can actually show with the mechanism. This is, once again, people who have two doses, they have a reason to have two doses. Then check this out. Moderna and Pfizer BioNTech. One dose, 38 or 38.38. That means if 100 people unvaccinated are exposed or were exposed to Omicron and were hospitalized, if one dose messenger RNA are exposed, same, the 38 will go to hospital. Two dose, 35 will go to hospital. Three doses, 30. So the number actually compared to unvaccinated is less. Now, in terms of reference to each other, if you see some tables here which are for cases, you would see that sometimes the doses related cases increase. And so, anyways, I'm now just repeating it. So you can easily search for this study, look at the data, and see what it means. The interesting thing for me in this data was the following. There is data here for previously infected, not infected, previously infected, not infected, vaccinated, not vaccinated. And it showed that, contrary to Paul is here, Paul, your message today and your analysis, this data showed that generally for everyone, whoever we are, vaccinated, not vaccinated, previously infected, not infected, generally for everyone, Omicron behaved with less severity. And we can actually see that. Let's say, okay, so this is so these are hospital admission. I want to go to the cases. So my apologies for these are clinical cases tested. Okay, so let's look at this one for a second. In this table, if we go to this table is demographic and clinical characteristics of cases tested in outpatient setting with Delta and Omicron infections. So if you can see here, this column, first, second, third, and fourth column, one is no SGTF and one is SGTF. The no SGTF, this side is Delta, and this side is Omicron. So if we go to now vaccination status, unvaccinated individuals, in terms of Delta, there were 49.7, and I believe that is percentage. Some of these numbers are per thousand, so this is percentage. So with Delta infections, 49% were unvaccinated. With Omicron infections, 26% were unvaccinated. So generally, almost cut in half the percentage of those who are becoming infected. I would say they become infected enough with symptoms to go to hospital and get themselves tested. Many people are actually not going, and when I called my doctor, he actually didn't want me to come in. So and he said, I'm seeing you, you look fine, and so whatever, stay home. Here 26.6% unvaccinated individuals with Omicron are going to they are being tested. That doesn't mean this is severe. That simply means they're tested. So maybe they got the symptoms and they became worried and they said, hey, can I be tested? And they said, yeah, sure, let's test you. One dose, Delta, 3.4% had one dose. Omicron also 3.4% had one dose. And if I go to Moderna and Pfizer BioNTech, I'm going to leave the adenovirus second dose. So one dose, Moderna, Pfizer BioNTech, 2.9%. Actually, let's not leave this second dose. So look at this one. Two dose with any booster. So adenovirus 1, and the second is any booster. With Delta 0.5 and with Omicron 1. So almost double. Why? Because Omicron's resistance to vaccines neutralization is less. So it is almost double. Then let's look at the mRNA vaccines. And once again, keep this in mind that overall for everyone it is reducing. Here the two doses is 1. Now Moderna or Pfizer 1 dose. Delta 2.9%, of the individuals were Delta, and 2.8% of the individuals who were one dose vaccinated were Omicron. Two dose vaccinated, 38.8%, 38.8%, two dose were Delta. And check this out. This is where this news cycles that you're seeing. 52.9% were Omicron. So now compare this to unvaccinated here. Unvaccinated, 26.6% had the infection. Double dose vaccinated had 52.9% in the Omicron group. Three doses. Delta had 4.6% and Omicron side had 13.4%. So if you compare them, the two dose, for example, people like me who were two dose, they were more. And you could actually see that their population sizes and those things are more. But anyways, these are percentages. So they have normalized them. So two dose vaccine, people had more cases of Omicron compared to two dose with Delta and compared to unvaccinated suffering with Omicron. That is the data. So if you go for the remaining parts of it, it's a beautiful study to look at. It's actually very, very interesting. If you go to the remaining part, you can see hospitalizations, you can see ventilation. I think they have ventilation data as well. So I had gone over this once before. Okay, so let's continue. Okay, so I'm catching up now. I'm at the end of the talk. So if you had your questions before, my apologies. They must have scrolled up. So Jake says, is it worth it for unvaccinated for natural immunity get the vaccine at this point? Delta was pretty mild in this scenario, not even a cough. So Jake, see, I can't give an advice, and I cannot say not take a vaccine. If I just said don't take a vaccine, YouTube would just take my channel down. Generally, my position has always been, and this is just my position, this is not an advice. If somebody had the infection and that infection was nothing for them, then number one, they have developed protection, although less for Omicron. Number two, they have shown that they can handle it. Having said that, there is no guarantee that if somebody has successfully handled Delta, will successfully handle Omicron. It seems like Omicron will be handled better, but because there still are people ending up in hospitals, it is really your choice and your doctor's decision with you or suggestion to take the booster or the vaccine or not. I previously, let's say we were just in the Delta time. At that time, I had maintained this that if you were infected once with Delta, you don't need another now vaccine because your body already knows how to handle Delta and has proven to you that I can handle it. So Kevin says, Dr. Bean, could you give your overreaching projection of perception of the virus becoming more of a mild flu by May, August 2022, given mass dissemination of Paxlovid and Omicron vaccine? I think that's what's going to happen. It is going to, number one, we will keep developing immunity because we'll become infected and we'll have immunity. So, for example, now I'm double dosed vaccine and I have COVID as well. So, my immunity should be a little better. If I survive, I'm still going through this, but if I survive this, then my immunity should be better. Unless my immunity changes for other reason, I become uncontrolled diabetic, or God forbid, some other terminal disease occurs and or immunosuppression occurs, then we have a different problem. But we're talking about healthy people. So if that happens, contrary to what many folks say, that when the virus would go around and will have pressure, it will become hardy, virus would actually become better and better to live with us. So it would become more fit. And the fitness of the virus is to keep us alive while it lives with us. So, in my opinion, this is an opinion part that as we keep adding these solutions and as the herd immunity continues to build, we should just start getting even milder outcomes. I still worry about this, that it has the capability of killing. I did a small comparison with flu before, and flu has about, in the US, 30, 40,000 deaths per year. Nowadays, they are lesser, but they are still high, uh, in that 29, 30,000 range. This study's rate of death, out of 53,000, there was one death. But again, this data is not in millions. So I don't know if we can scale it to millions and say that is what would happen. If we create percentages, which is kind of scaling, then Omicron's damage is lesser than flu. But that is based on this California study that I just showed you. We need some more data to become even more confirmed. So I'm hoping that it would become better. This is what I was hoping before as well, or I was discussing that as this virus takes more time in circulating, it would become better and better or milder and milder. It is just that some folks had been claiming that it would become worse and worse. And I wish it doesn't become worse. Fingers crossed. I don't want to have a match on that somebody else is proven right to say, look, it has become worse. I hope it does not. John Snyder says does not need to keep you alive. Well, John Snyder, at the end of the day, it will have to, if it want to live with us, it doesn't have to keep killing us. So, like other human coronaviruses, it would have to start to live with us. Daniel says, thoughts on Novavax. Will it be effective for all variants? So that is an interesting one. Novavax's protein, so far that I know, is for the older variants. So it may not be as effective, just like others as well. Gift says, take Luffy for a walk every day. So Margaret has been, suggesting that too. And so one day I actually just generally, Luffy went out and I went out as well. And I thought he would walk with me. He just ran off. So I'll have to somehow put him in a basket or something. Janita, this is a good question. Do you think USA will approve Novavax? I'll take that one. So Novavax keeps seeming to have to prove more and more. So I don't know what it is. It is Novavax or the US. I wish it gets approved. So Carlos says, hi, Dr. Bean, when Novavax files for EUA, can you please do an updated talk? I'm concerned about rate of cerebrovascular accident as shown in previous study, 3 times the placebo. That is bad. Okay, will do. So Dan says, what tweaking did you do to the FLCCC protocol? So let's see the protocol. I haven't even seen the published one yet. I got to do this one. 150,000 people in this study, huh? So my main input was on the I recover. So I think I recover is yet being updated. Yeah, so this is still being updated. This is the area where my primary input was. So not yet fully updated. That's interesting. So Claire says a cat can learn to walk on a harness. So that's very interesting. Okay, so I'll try to put a harness and take him out. I always worry that he will wear a harness and he'll go get entangled somewhere running around, and then there'll be a problem. Christine says, get him a harness. Okay, I'll try it. We actually have a long harness. Before he used to be able to go out freely, we used to have a long harness with which he would just go out and sit for a few minutes and come back. And maybe I should try that. Vinod says if Omicron largely infects the upper respiratory tract, can it even easily enter the bloodstream and cause systemic illness? What is the pathway? So, anytime, wherever there is inflammation, over there the blood vessels are opening, rupturing, they are dilated, and through that the debris and things can enter. Although our immune system tries its best that this does not happen, but this can happen. Robin says 535 people are watching. Smash the, yes, absolutely. Smash, hit the like button. Yep. Ramnik says it's a very smart animal which moves, adjusts body scientifically and lands on its feet. Yep. So when we used to study physiology, there were doctors who would do experiments on cats, and they would damage various parts of their brain, and then they would throw them, or they would see how they land or how did they react, and from there they started mapping how our brains functions are, and then eventually they started studying or observing those in humans as well. But animals have done a lot of they've given a lot for us to understand more. This is correct. Serotonin says, Dr. Bean, sleep is the most important meal of the day. Time for you to sleep. Yes, it is. So let us yes, yes, I'll have to have a claw protection. He has injured me many times, but more than me, he has injured my wife. So Marla says that Dr. Corey went over the changes. Let's see quickly. So I just looked at my changes, which are probably still in process. So is the eye mask plus updated? Ivermectin, post-COVID exposure, prevention, gargles, early treatment, antivirals, antiseptic, aspirin, nutritional therapies, melatonin, honey. Yes, I love it. Second line, very good. Very good. I love that sotrovimab is here, although very much in less. But for the at risk individuals, I believe that they're making it available. Tables, vitamin D levels, very good. I like it. So maybe we'll do a quick dive into this at another time. So, with this, let's close for today And okay, so let's close for today. Please like, subscribe, and share. And if you would like to support this work, there are links in the description. You can buy me a coffee, or you can use PayPal, or you can buy me one monthly coffee on Patreon. Thank you very much, and I would see you tomorrow.